Thank you, Chairman Harkin and Ranking Member Alexander. I'm pleased to introduce Massachusetts Dr. Vivek Murthy, who has been nominated to be our next Surgeon General. He has already had an extraordinary career. Dr. Murthy has worked as a physician, as a researcher, as an educator, and as an entrepreneur, working to improve health across the country and around the world. Dr. Murthy earned a bachelor's degree from Harvard and his MD and his MBA from Yale. He is currently an attending physician in internal medicine at the Brigham and Women's Hospital and an instructor in medicine at the Harvard Medical School. Dr. Murthy was appointed by President Obama to serve on the advisory group on prevention, health promotion, and integrative and public health in 2011. In this role, he serves as an external advisor to the National Prevention Council, a panel that is chaired by the Surgeon General. Now, I believe that Dr. Murthy has proven leadership and initiative. He has co-founded several organizations, including Trial Networks, a company that helps to improve efficiency in clinical trials using social media platforms. And he co-founded Visions, a nonprofit organization that educates young women in India about HIV and AIDS. As the co-founder and president of Doctors for America, Dr. Murthy has engaged thousands of American physicians in health policy. I had the pleasure of meeting personally with Dr. Murthy, and I was struck by his passion for his work. Throughout his career, Dr. Murthy has excelled as a physician. He has demonstrated his dedication to improving public health, and he has shown the ability to mobilize and to energize communities. Given his obvious drive, intellect, and unique combination of professional experiences, it is not surprising that his nomination has earned the support of many organizations, including the American Public Health Association, the American Academy of Pediatrics, the American Hospital Association, the American Cancer Society, the American Heart Association, as well as a former director of the Centers for Disease Control and a former general counsel of the Department of Health and Human Services. They all recognize the extraordinary leadership that Dr. Murthy has already demonstrated and what he could do in the role as Surgeon General. Dr. Murthy is well equipped to serve as a 21st century Surgeon General. I know that his diverse experiences will provide a valuable background as he steps into this new role once he is confirmed to serve as the nation's Surgeon General. Welcome, Dr. Murthy, and we are pleased to have you and look forward to today's discussion. Thank you. Dr. Murthy, in your statement, you spoke about wanting to work at the community level to reduce obesity in this country. And this is an important goal, and we have evidence that partnering with local communities is a strategy that we know works. We've seen it work in Cambridge and in Fall River, Massachusetts, two cities that have been nationally recognized for their community-based efforts to reduce diabetes and to improve fitness. We've seen it work in Boston, where community-based local programs have reduced kids' trips to the doctor due to asthma and lowered the risks of lead poisoning. And I've seen it firsthand in the remarkable initiatives led by community health centers across our state that address specific needs in the neighborhoods they serve. But we know that community health programs are often starved for resources. Across this country, local public health departments are struggling, and many face the double hit of shrinking federal investment and local governments that are simply running out of money. You recognize the difficulties of tight budgets and often partisan rhetoric about prevention and public health. So perhaps you could say a bit about how your experience has prepared you to work with local partners to achieve your goals.
Thank you, Senator Warren. The topic of partnerships is, I think, critical to how we are going to achieve progress when it comes to public health. One thing that I have recognized and realized in my work that I have done, but not only in starting several nonprofits, but in starting my company as well, is that in all of these efforts, I have begun not with lots of funding and lots of connections, but with actually very little, starting with an idea and then figuring out how to build that into something meaningful that can impact health. And what has made these efforts successful, in my opinion, a key part of it has been partnerships. When partners work together, I believe they can achieve far more than when they work alone. When I worked building HIV/AIDS education programs, for example, I was able to bring together unlikely partners, principals of convent schools, principals of traditional schools, parents who were conservative, parents who consider themselves liberal, students who were scared about issues like HIV and others who wanted to embrace it. I was able to bring together different partners and communities to build programs that ultimately impacted tens of thousands of students. I did similar work in rural parts of India when I built community health partnerships with colleagues to serve rural healthcare needs. And there also, we worked hard to build partnerships between hospitals, between community leaders who were often suspicious of the work that we were doing and often actually had difficult relationships with each other. We had to find ways to bring them together around the unifying issue of health. And finally, with the work that I've done for Doctors for America, we have run campaigns around prevention, where we have brought community partners together, including local churches, local medical organizations, and other healthcare organizations in the city, to come together to educate communities about prevention. We have put together actual action campaigns where we've had doctors, for example, do runs all across the country to help set an example of healthy living and to bring their colleagues and their patients to run with them. That has served as an opportunity to bring the community together. The reason I believe this experience with partnerships and the approach of partnerships is so important is for the reason that I mentioned in my opening statement, which is that we need to, and we absolutely must move toward a model where all parts of society see the role that they can play in improving health and participate and work together to achieve a healthier population and a healthier nation. And I believe that if I have the opportunity to serve as Surgeon General, that one of the most important parts of the job, and a part that I will certainly look forward to the most, is the opportunity to connect with and build these kind of partnerships so that we can achieve concrete health improvements in our community.
Let me just see if I can hit very briefly. I think that's just powerfully important what you've said. Your demonstrated leadership and your clear vision for the future, I think, serve this country well. And I'm very pleased that you're willing to serve in this role. Mr. Chairman, I see that my time is short. I'll yield back.